Hello guys, welcome to our channel PKR Vibes Career and Growth. First of all, thank you so much for your time to spending here to learn something new today. Today we are discussing about new patient qualification not met scenario in a denial management or in a medical billing. So before that, we have to understand what is the denial management. Generally, if you are submitting any claim to insurance, insurance will process your claim. Acknowledge your claim. After that, they will receive your claim. After that, they will process your claim. This all steps is known as a claim adjudication. Once your claim is processed by your insurance, insurance will decide they will give the payment or they will give the denial for your claim. So generally, we are now talking about denial management. Now we can consider that your claim is processed by insurance. After that, it is a denied by your insurance stating CO B16. It's nothing but new patient qualification not met. So nothing but your claim is denied by the insurance. This procedure or this steps is known as a AR denial management. So here the thing is, as a AR caller, you should have to understand why the claim is denied. So you should have to do a pre-call analysis before calling to insurance company on your denial. You should have to understand is the this denial is required call or not. So you can complete your claim without calling to insurance if you are good at analysis. So AR calling is nothing but every time you should have to not do call on a scenario. Every scenario doesn't require calls. So but some scenarios should be required call. So necessary call is required for your scenarios, and unnecessary calls also you should have to avoid on your scenarios. So that is a depends on analysis skills and also follow-ups, denial follow-ups. So what I'm telling is, new patient qualification not met scenario doesn't require call if you are good at analysis. So if claim is denied incorrectly, okay, then at the time we required call to insurance and we have to prove the same thing. So generally we have to understand that CO B16 denial doesn't require call if you are good at analysis. I will explain in the next steps. And also you have to understand that whenever we submitted any office visit ENM codes to the insurance company, then we will get the denial CO B16. So we all of you know that office visit procedure codes are nothing but 992012 to 99205 CPT codes is known as a office visit new patient ENM procedures. So whenever you submitted this claim to insurance, insurance will uh, process your claim. After that, they will deny that new patient qualification not met. Nothing but he is a establishment patient. Nothing but he is not a new patient. So how you can how you can have to analyze the claim, and previous procedure billing history you should have to check. And now we will discuss about the scenario in depth in the next slides. Okay guys, before we discussing about pre-call analysis and on-call analysis and also end action of this scenario, we will discuss about the small concept regarding this particular denial COB16. So nothing but new patient qualification not met. See, generally there are a ENM codes will come to this scenario. ENM code is nothing but face-to-face conversation between the doctor and patient or patient family. So regarding the treatment or regarding the symptoms of the illness. So this is known as a ENM codes. Generally, if the patient is met the doctor at the first time, so in his life he met the doctors first time, or after long duration also, if the patient is met the doctor, that will be known as a new patient. So he is a new to uh, doctor to visit or to get the treatment from him. So that is a new patient. So generally, new patient ENM codes are nothing but 99201, 99202, 203, and 99204 and 99205. So 99201 to 205 CPT codes are known as a new patient office visit ENM codes. Office visit is nothing but clinics or outpatient hospital visits. These are known as a office visit. So for example, if the conversation between the doctor and patient regarding the diagnosis or illness or regarding the treatment, whatever it is, if the conversation is happening between the doctor and a patient about the 60 minutes, So that patient is new patient. About the 60 minutes duration is known as a 99205 CPT code. We can understand that if duration is more, then we have to append the 99205 CPT code. For example, duration is 10 minutes, it's very less, we have to append 99201 procedure code to the insurance. So here, while we are billing this claim to insurance, we have to understand that we are submitting claims to insurance 99201 to 99205. Insurance is stating that denial, new patient qualification not met. Nothing but as per payer guidelines, as per insurance guidelines, insurance is telling that whatever you build claim along with the procedure code, any procedure code 99201 to 205, they are telling that your procedure qualification, new patient qualification not met. So nothing but your procedure is not a new patient as per insurance guidelines. So we have to understanding basic thing that okay, whatever we submitted procedure might not be the new patient, nothing but is a established patient, is already existing patient. So coming to office visit, existing patient or established patient ENM course is nothing but that patient is frequently visited doctor last 1 year, last 1 month, last week or last 2 years. So like that, that patient is already existing patient is known as a established patient. So that established patient, how we can understand, how insurance will understand this is a established patient is nothing but if you are submitting any claim between the CPT range 99211 to 99215, then insurance will understand that this patient is a established patient, this patient is a already existing patient. So here, if the duration is more high, then you should have to bill the claim to insurance along with the established ENM codes of 99215. If the duration is very less, but is a established patient, is already existing patient, but the duration is very less, so then at the time we have to append, or we have to, sorry, bill the claim along with 99211 CPT code, then because there is a duration of 5 minutes. See guys, this ENM codes is nothing but just a discussion between the patient and doctor. It purely depends on a duration of the time, how much time the duration is happened is a ENM codes. See, I give an important note here. If patient is not seen doctor within a 3 years, then established patient, nothing but existing patient becomes a new patient. For example, you are a patient, so you met a doctor last 3 years. For example, we consider in the year of 2020, 2020 year, you visited doctor and you taken a treatment regarding your illness. After that you didn't went to doctor, then now in the year of 2024 you visited doctor. In between you didn't visit a doctor, then you already existing to patient, I mean existing to doctor, but the duration is 3 years is there, so then you will be considered as a new patient only. So here you will be not a existing patient as per health insurance records or guidelines. So you will be considered as a new patient only because you are not seeing doctor within a 3 years, there is a long gap as per payer guidelines. Now you will be known as a new patient only. So that is what you have to basic and important key point here you have to note at this scenario, for this scenario. Okay guys, now we are discussing about pre-call analysis of new patient qualification not met scenario. So generally not for this scenario, every scenario having pre-call analysis like this. So first you should have to check your claim status. For example, we submitted claim to insurance. We don't know any status, right? At that time, our basic thing is we have to check claim status in our doctor's respective billing software, PMS, practice management system. So you should have to check the claim status in your doctor's respective practice management system, nothing but billing software. So for example, you didn't find any information in a billing software, then your next alternate is you should have to check the claim status in doctors internal clearing houses, right? We know that what is clearing house. Clearing house is nothing but it is an electronic claims we are submitting from our internal doctor side to insurances. So it's nothing but intermediate between the uh, our internal uh, doctor system and to the payer system. It's like software, it's like gateway. So it's nothing but if we want submit any claims through electronically, our doctor have a internal clearing houses, we are submitting electronic claims through that gateway. So in that way we have to check that particular gateway and nothing but that particular clearing house for the claim status. For example, we submitted claim to electronically, then we have to check the claim status in that particular portal, or sorry, particular gateway, particular intermediate clearing house. So our first job is we have to check the claim status in our doctor's internal, I mean doctor software. In software we don't find anything, then we have to check in our clearing houses. And even you check in doctor software and clearing houses, you are nothing to find any claim, then it is a better to check the claim status in respect to payer portal. If you have a portal access, for example, we submitted claim to insurance, for example United Healthcare or 8 now or Humana, whatever it is. For example, you are submitting but you don't find any claim, then you have to check the claim status in that particular portal. In portal you have to give the required information like patient details, then you will get the claim information. So like that, if you have access, please could you please check your claim status in a respective portal. Why I am telling this all information is, if you are getting any denial, any denial management blindly, if you are doing call to insurance, you are not a good AR caller, because we have to check, we have to complete our claim without calling to insurance is a good job as per my decision. Because if you are good at analysis, you will do this thing. If you are not good at analysis, simply if your claim is denied, then you are pick up your headphone and you are calling to insurance for the claim status. It's a waste of your time sometimes, not all times. If denial is there, denial standing, even you are checking anywhere, denial is standing the same, then you have to denial follow-up is required for the insurance. It's a good job actually, but the thing is every time calling is also not a good thing to AR caller. So because analytical skills is very important, basic analysis is nothing but very important on any denial. That is what I am discussing about pre-call analysis on a scenario. And for example, you checked claim status in software or clearing houses or portal, anywhere you found claim is denied so and so reason, CO B16, nothing but new patient qualification not met as per the payer guidelines. Then what is pre-call analysis? It's very important. You should have to check the previous procedure history. So for example, we build CPT 992012 to 99205 ENM code as a new patient to the insurance, but insurance is telling that this is not a new patient as per our guidelines. Then our job as a pre-call analysis is we should have to check the previous billing procedure history. We build any ENM code to the same doctor, to the same payer or not. So if we bill other ENM code within the 3 years to the same doctor, then we can understand that okay, this is not a new patient, this is already existing patient. We already the patient is already met the doctor for the treatment previously within the 3 years, then he is a established patient, then insurance is correct. In that way you should have to do a analysis on a claim. Okay guys, now we are discussing about AR caller steps for new patient qualification not met scenario in denial management. See, first, for example, as a pre-call analysis we discuss now, there is a no status. For example, you consider that there is a no status in a your respective billing software and in your respective internal clearing houses, and also in respect to payer portal, you are nothing find any claim status. You are submitting claim to insurance, but you don't know the status in all internal sources. Then our next job is you have to call to insurance for getting the claim status. If the denied UOB not found, then only call is required for this scenario. So for example, you are calling to insurance. Hi, this is Thomas. I am calling from provider's office checking on a claim status, please. So in that way, you should have to ask the claim status to the insurance representative over the phone call. Your first question is, may I know the claim status, please? So based on, they will tell that okay, your status is claim is received and claim is denied, and claim is denied stating new patient qualification is not met. Their answer should be like that after you are providing your searching information to the insurance representative. For example, you checked your internal clearing houses portal or in your respective software, you confirm that okay, claim is denied by the insurance stating CO B16, nothing but it is a denied new patient qualification not met. So then your question is, may I know the denied clarification please. But you have to, as a AR caller, you have to understand one thing: this denial doesn't require call, because if you are good at analysis, this denial doesn't require any call. But if claim is denied incorrectly, then this denial should require a call. So coming to note here coming to note one, if you are a good at analysis and you confirm that patient is seen doctor within the 3 years, so nothing but patient is seen doctor within the last 3 years is nothing but he is a existing patient, he is a not a new patient. But we submitted claim to insurance along with the 992012 to 205 CPT codes. It's nothing but we are telling to insurance that this patient is a new patient, but insurance is telling that denial CO B16. It's nothing but your patient is a not a new patient as per our guidelines. Then your understanding is nothing but you should have to check the previous billing history, and if you confirm that yes, really there is a patient already visited a doctor within the 3 years, then insurance denial is a correct, right? Nothing but your patient is a existing patient, established patient, then payer's call is not required for this CO B16 denial. That means insurance is denied correctly. Yes, our doctor is already given treatment to the patient within the 3 years is nothing but our patient is a existing patient, not a new patient, but we build claim to insurance like a new patient. It's our fault, it's nothing but insurance is denied correctly. At the time call is not required because you confirm that previously we submitted previously our patient is visited doctor within the 3 years, so we have to change the CPT code accordingly. So by reviewing the medical record we have to change the CPT code. If you doesn't have that kind of more knowledge to change the CPT code as per your medical records and previous medical records, it is a better you are tasking this claim to coding assistance. So I am telling that yes, call is not required if the claim is denied correctly, and also your analysis is good and you found that previous procedure history also done within the 3 years. And coming to note 2, if you are good at analysis and you confirm that patient is not seen doctor in last 3 years, insurance is denied that new patient not qualification not met. But you checked your previous procedure history, patient is not visited our doctor within a 3 years, or we completed 3 years also, but doctor is not visiting, doctor is not given treatment to our patient in that particular 3 years, nothing but he is a new patient only. As per insurance guidelines, he is a new patient only, because if the patient is not visited doctor within a 3 years, the existing patient or established patient becomes a new patient as per guidelines, payer guidelines. You should have to probe this thing on a call. If you confirm that there is a no previous procedure billing history for this patient and a doctor within a 3 years, then nothing but he is a new patient only. At that time call is required to the insurance and probe the same thing, there is a no previous procedure history like that, so our patient is a new patient only. So tell me why you have to deny clarification is required, why you denied this claim like this. They will give the reason why as per how they are uh, uh, reviewed and denied the claim. So as per payer guidelines they will give the exact reason. At that time you should have to probe this information. For example, if insurance representative also reviewed and agreed for your probing skills, they will reprocess the claim. Nothing but patient is not seen doctor within the last 3 years is nothing but patient is a new patient. So as a AR caller, you need to probe the same thing with the insurance live representative on call and need to reprocess the claim over the phone call itself. Okay, for example, if insurance representative agreed and reprocess the claim, your next question is, may I know the claims reprocessing tat turnaround time, how much time it will take to review the claim back and to give the payments. So generally it will like 15 to 30 business days. So this question is required if claim is denied incorrectly and reprocessed. So for example, yes, patient is not seen within the last 3 years, everything is good, but payer is not agreed to take the reprocess, but you confirm that denial is incorrect. In that way also you can assist, you can get the help from your internal coder. And coming to next question is, may I know the claim number, corrected claim, mailing address and TFL. Why? Because for example, patient is seen doctor within the last 3 years, it is nothing but denied correctly, we have to change the procedure code accordingly. At the time we have to submit the corrected claim. So it is a better to take the corrected claim, mailing address and timely filing, because we have to change the CPT code accordingly and we have to submit the corrected claims to the insurances. So claim number, if it is claim is denied and we have the UOB, claim number is not required. But if you are calling for claim status, after that you confirm that it is a new patient qualification not met, at the time you should have to request a claim number and also request a UOB also required, because you don't have UOB in your sources. And finally you should have to take the call reference for this scenario. So simple guys, again, if it is a denied correctly, you have to task the coding. If denied incorrectly, try to reprocess the claim over the phone call. If refused, you have to document that information in your call notes, and you should take for your next steps like coding assistance. Okay guys, now we are discussing about end actions for the new patient qualification not met scenario, or COB16 scenario in a denial management. The first end action for this claim is, you should have to reprocess the claim if claim is denied incorrectly. For example, you submitted claim to along with the 992012 to 9920 CPT code, but you confirm that it is a denied incorrectly. For example, there is a no established patient ENM codes found for this patient and doctor, nothing but is a new patient. You confirmed it is a new patient only. At the time you should have to probe the same thing and you should have to reprocess the claim. First action. Next action is task to coding review if claim is denied correctly. For example, we submitted claim along with ENM codes 992012 to 99205 CPT codes to the insurance. Insurance is telling that as per our payer guidelines, this is a new patient qualification not met. So nothing but you also reviewed your previous procedure history and you confirm that okay, there is no sorry, there is a some within a 3 years the patient is visited a doctor also, there is a previous procedure history found that okay, he is a not a new patient, he is a existing patient, nothing but he is a established patient. So nothing but here we have to bill to insurance along with the existing patient, established patient ENM codes, like nothing but 992112 to 99215. So this review will be taken by a coding team by reviewing the medical records, and also they will uh, change the CPT code accordingly from the 992012 to 205 CPT codes. From 992012 to 205 CPT, they will change to 99211 to 215 during the conversation happening. So like that, if claim is denied correctly, then you should have to take a coding assistance to change the procedure accordingly. So two end actions, one is reprocess if claim is denied incorrectly, one is you should have to task to coding if the claim is denied correctly, so that they will change the procedure accordingly. So this is about the induction guys, and I'm requesting guys, if you are watching my video first time and if you not yet subscribed, could you please subscribe our channel PKR Vibes Career and Growth, and hit the bell icon so that you will get every my video as a notifications to your mobile or your desktop. Guys, if content is useful, could you please like our video so that it will reach us many more needy people who are looking this kind of content. And thank you so much for your time again. And thank you for watching, and have a good health. Bye for now.